I hope everyone is doing good. Today we are going to talk about the vitamin deficiency disorders. Before heading towards the deficiency disorders, we are going to talk about the vitamins, what really these vitamins are and what are these used for. Why they are very necessary for our growth and development. So these vitamins, they are the organic compounds which are required in our diet. That means in our daily diet, what we are, eating, what we are having on the daily basis, and that too in the small quantities to perform some of the biological functions. And usually these vitamins, they are obtained from the food we eat, or they can be obtained from the supplements. These vitamins, they are classified according to their solubility. There are usually 13 vitamins known, right? Do you understand that these 13 vitamins are known to you? Well, among the 13 vitamins, there are 4 fat-soluble and 9 water-soluble vitamins. So when we talk about these fat-soluble vitamins, these are absorbed through the intestinal tract and with the help of lipids. That means with the help of fats, they are being absorbed from the intestinal tract. There are usually 4 fat-soluble vitamins, for example, vitamin A, vitamin D, vitamin E, and K. These fatty vitamins, they are readily available in our body and they are stored in the body's fatty tissues, and they are present in the liver. So the excessive consumption of these fatty vitamins can lead to the accumulation, as well as they can have the toxic effects. Then we'll talk about the water-soluble vitamins. These vitamins are dissolved in water easily and they get readily excreted from the body. These water-soluble vitamins, they are carried to the body's tissues, but they are not stored in the body like the fat vitamins does. There are 9 water-soluble vitamins, which may include the vitamin C, the vitamin B group. That means the vitamin B1, B2, B6, B7, B12, and like that. So now we have reached to the disorders or the vitamin deficiencies. So what basically is this vitamin deficiency? This vitamin deficiency, it's a condition of a long-term lack of a vitamin when caused by not enough intake of these vitamins. So let's start deficiency of vitamins with the vitamin A deficiency. Lack of this vitamin A, when there is not enough presence of the vitamin A in the body, then we can call it as a vitamin A deficiency. It's mostly very common in the developing countries. As we all know that the night blindness, it is one of the first sign of the vitamin A deficiency, right? The xerophthalmia and the complete blindness, they can also be the sign of this vitamin A deficiency, as this vitamin A has the major role in the phototransduction as well. So this phototransduction, it's the conversion of the light into a change in the electrical potential across the cell membrane. What basically causes this vitamin A deficiency? When the child breastfeeds from the mother and the mother is having this deficiency of vitamin A, and as it contains a very little amount of the vitamin A, which provides the breastfed child with too little intake of the vitamin A. So next cause can be the malabsorption, and ineffective absorption of the vitamin A in the body can lead to the vitamin A deficiency. Malnutrition is one more cause leading to the vitamin A deficiency, as there is the inadequate intake of the vitamin A, which is actually required for the body, and it leads to this kind of deficiency. The next cause can be the zinc deficiency, as it impairs the absorption, it impairs the metabolism or the transport of the vitamin A, because it is very essential for the synthesis of vitamin transport proteins. And next cause can be the iron deficiency, as it can also affect the vitamin A uptake. So we can find out this vitamin A deficiency with the help of the clinical manifestations. The first, at the beginning, what we get when we have an idea regarding the vitamin A deficiency, that is the night blindness. So there is a difficulty for the eyes to adjust to the dim light, right? And the affected individual, they are unable to distinguish between the low levels of illumination. So this night blindness, which is caused by the vitamin A deficiency, it's associated with the loss of the goblet cells in the conjunction of the eyes. Then the next condition, the next manifestation which is seen under this vitamin A deficiency is the xerophthalmia, as there will be failure of the formation of the tears in the eyes. Next manifestation we can find out is the xerosis conjunctiva. There, the presence, which the conjunctiva which is present in the eye, it's dry, it's thickened, it's wrinkled, as well as it's pigmented due to the keratinization of the epithelial cells. Then the next manifestation we can find out is a bidot spot. It's the grayish or the white plaque or the patch type, which is formed of the desquamated conjunctival epithelium, which actually is adhering to the conjunctiva. Next condition under these manifestations is the keratomalacia. When this xerosis of the cornea, xerosis of the conjunctiva is left untreated, then it leads to the development of the keratomalacia, and it's the corneal epithelium which becomes opaque and ulcerated. And obviously, when there is the deficiency of these vitamins, there will be impaired immunity present in the child, and there are usually the chances which increase the risk of the infection, especially of the air and the urinary tract infections. The other symptoms which are related to this vitamin A deficiency include the blurred vision, the bulging eyes, cataract, as well as the conjunctivitis, presence of the cross eye, itching and watery eyes, presence of the pale skin, and there will be the scaly dermatitis, the dry skin. Now we have to see the management for this vitamin A deficiency. The first thing we are going to do is the supplementation. That means we have to provide some of the supplements which may, hike this vitamin A in our body. So the mild to moderate cases of this vitamin A deficiency people, right? So they are at least given the 1000 microgram per day of the vitamin A dose. In case of the severe, the cases of the people with vitamin A deficiency, they are given the vitamin A dose of 50,000 microgram per day for at least few weeks. The next most important thing which comes under the management is the dietary consumption. So the consumption of the yellow, or we can say the orange fruits and the vegetables which contain the carotenoid, and especially the B carotene, which is very essential. Along with the dietary things, along with the supplementations, there are some of the preventive measures which can be helpful for preventing vitamin A deficiency. So these prescribed supplementations, for example, the vitamin A, the palmitate, or the aquasol, these are all the common trade names which are available in the markets, and they are given to the child as well as to the mother. The maternal high supplementation of the vitamin A, it not only benefits the mother, but it benefits the breastfed infant too, as it can provide the breastfed infant the good amount of the vitamin A through the breastfeeding. And as I mentioned that the increased consumption of the foods rich in the vitamin A, for example, which are rich in the animal origin, the dairy products, the fish, the meat, especially the liver of the fish, then reducing the severity as well as the factors which are actually contributing towards the vitamin A deficiency. For example, the protein energy malnutrition, for example, the absorption, as well as measles and diarrhea, which can lead to such deficiency. And administration of the vitamin A as a part of immunization schedule. There's a condition when there is an excessive amount of this vitamin A intake, then that leads to a condition called as hypervitaminosis A. Yes, you heard me right. So when there is increased amount of this vitamin A in the body, it leads to the toxicity which may result in this condition. The signs and symptoms for this toxicity may include the nausea, the irritability, the blood vision, as well as anemia. The next deficiency which we are going to talk about is the vitamin D deficiency. Lack of vitamin D in our body, which results in the vitamin D deficiency in the children. This vitamin D deficiency, it can lead to the loss of the bone density, which is called as the rickets. There are certain risk factors which may lead to the deficiency of vitamin D. Children aged three months to the 3 years, they are at the higher risk because this is the period of growth and development. There can be the chances when there is an inadequate intake of the dietary vitamin D. Another the important risk factor which may lead to the deficiency of vitamin D is the lack of sun exposure. So the clinical manifestations of this vitamin D can be the most prominent manifestations or the effect of the vitamin D is the rickets. This rickets, it's characterized with the bone deformities. There's a terminology called the rickety rosary. It means there is a formation of the small, round, unossified areas of the skull bones, as well as at the beating of the osteochondral junction of the ribs. The common skeletal deformity, which may include the craniotapes. There will be the chances of delayed closure of the anterior fontanelle in the newborns. There will be the delayed eruption of the teeth. There will be enamel defect. So in this rickets, you can find out the legs of the children. They are boat shaped and there are the knock legs present. There is an increased chance, there's an increased frequency of the green stick fracture among the children. Next clinical manifestation you can find out as the osteomalacia, which means the bone deformity occurs due to the weight of the body on the weak balance. Other features of the vitamin D deficiency may include the babies who are with this the severe deficiency of vitamin D. They have the muscle cramps, they are having the seizures, they are present with the breathing difficulties. Obviously, they'll be having the poor growth. Their tooth eruption, it's delayed. There will be presence of the cardiomyopathy. That means the heart muscles are getting weakened. How can we diagnose this vitamin D deficiency? According to the medical history, the symptoms we can find out as well as the history of the lifestyle. That means the breastfeeding, the history of the diet the child is taking. Then we can go for the blood test for the serum calcium as well as the phosphorus levels. Atrial blood gas analysis, which may be helpful in the metabolic acidosis. Then the next thing we can go for the liver function test, which may show some of the genes which are linked with the vitamin D deficiency. Then we can go for the wrist x-ray for the child, which can show the change over the wrist bone. So now we are going to talk about management for this vitamin D deficiency. For the treatment of this rickets as well as the osteomalacia, for this the vitamin D, it's given in a dose of the 1,000 to 5,000 international units, and it's given orally for a month, which is followed by 800 IU daily for 6 months. So the prevention for this vitamin D deficiency can be. This vitamin D deficiency can be prevented by providing enough vitamin D intake, providing intake of the vitamin D fortified foods, exposure to the sunlight, which is very cheap and which is very helpful. Administration of the vitamin D to the nursing mothers, which may be helpful for both mother as well as the breastfeed infant. Again, when there is the excess of vitamin D intake in the body, then it may lead to a condition called the hypervitaminosis D. which can be manifested by the dehydration, which can be seen by the vomiting, irritability, as well as the fatigue and muscle weakness. Then we'll talk about the vitamin K deficiency. Vitamin K deficiency occurs in the children when the child does not take the vitamin K properly. This vitamin K deficiency definitely will be interfering with the normal physiological changes. There can be various causes which may lead to the vitamin K deficiency. So this vitamin K deficiency, it may be or it can occur due to the inadequate intake of the vitamin K during the pregnancy, and which can cause some of the hemorrhagic diseases in the newborn. Such infants will be having the low levels of the prothrombin. Next cause can be the malabsorption. So the inadequate absorption of the vitamin K may result from when there is lack of bile in the intestine due to the defective secretion of the bile from the liver, when there is pyloric or the intestinal obstruction. And this malabsorption can be due to the decreased production of the vitamin K in the intestines, as seen in a condition called the Crohn's disease. So the clinical manifestations for this vitamin K deficiency can be. So there will be the abnormal bleeding even from the small cuts. There will be spontaneous nose bleeding. Bruises can be found. Presence of the bleeding gums. Presence of the blood in the urine or in the stool. We talk about the management of this vitamin K deficiency. First of all, the dietary intake of the vitamin K rich foods. The most common vitamin K rich foods are like the green leafy vegetables such as the kale, the collard greens, broccoli, spinach, cabbage, and the lettuce. Again, the hypervitaminosis K. When there is an excessive intake of the vitamin K, which can lead to the diarrhea, it can lead to the hemorrhage, as well as there will be the heart palpitations. Now we'll move towards the vitamin C deficiency, or you can call it as deficiency of the ascorbic acid. The most common thing which comes in our mind when we hear about this vitamin C is the scurvy, right? So the scurvy, it's the disease which occurs due to the deficiency of vitamin C. It's also called as the bleeding gums. This deficiency usually occurs between the age of 6 months up to the 7 years of the age. So we can see some of the clinical manifestations for this vitamin C deficiency. In this, the first manifestation we can see is the infantile scurvy. The early symptoms of this infantile scurvy can be seen as the loss of appetite and the listlessness. When the arms and legs are moved for this infant, there will be, the excessive crying seen in the child. At the ends of the long bones, there will be presence of the swelling. You will find out the bruises type, the hemorrhagic, the patches under the skin. These gums, you will find out they are swollen. It may lead to the convulsions, and if these convulsions continue, then it may lead to the death of an infant. Then this scurvy is also present in the adults. In adults, this scurvy is manifested as the presence of the general weakness. There will be the spongy bleeding gums. In adults, they lose their teeth with the dissolved dentine. There will be swollen tender joints. And again, for them also, there will be the presence of hemorrhage under the skin or, in various tissues also. The diagnostic evaluation, it's done on the basis of X-ray of the limbs, vitamin C levels in the blood, vitamin C levels in the urine, and this vitamin C deficiency is found with the help of these clinical manifestations. Now we have reached to the management for this vitamin C deficiency. The first thing which comes is the diet which is rich in vitamin C. So the orange, the lemons, the broccoli, sprouts, the red pepper, then spinach, cabbage, and you can see the green leafy sweet potatoes, tomatoes, and there are so many foods which are rich in vitamin C. So the adults must be given the dose of ascorbic acid in 100 gram intramuscular twice a day. So thereafter, 500 mg ascorbic acid is given orally and in a single dose for 1 month. Infants are given the dose of ascorbic acid 50 mg intramuscular twice a day for 1 week. Thereafter, a dose of 100 mg per day is given orally for 1 week. And vitamin C toxicity, it can be when there is an excessive amount of vitamin C in the body. A dose of about 1 mg per day, it can cause the vitamin C deficiency, which is manifested by the nausea, abdominal cramps, as well as the kidney stones. I hope this was very helpful, and I'll see you in the next session. Take care.